Prenatal care. Prenatal care should ideally begin prior to conception. The goal is to optimize the health of the mom and the fetus and increase the odds that the fetus will be born healthy to a healthy mom. Early prenatal care allows for initiation of strategies to promote good health and early intervention in the event a complication occurs. Assessment of maternal and fetal well-being is the focus of prenatal care. The role of the nurse is to screen mom, monitor vital signs, provide education, collect data, answer questions, and complete ordered procedures. The first prenatal visit should occur as soon as mom feels she's pregnant. We confirm the diagnosis of pregnancy. This is usually going to be the longest visit. We collect baseline data. Major objectives of this visit will be confirmation of the pregnancy, identifying any risk factors, determining the due date, which is all important, answering questions, and these objectives are met through a thorough history. The chief complaint, which is usually a missed menstrual period. So we determine the symptoms. What is her reproductive history, including menarche, the usual menstrual cycle, her gravidity, in other words, how many times has she been pregnant? Nulla gravida means first pregnancy, nulla meaning no, multi meaning more than one pregnancy. Parity is the number of pregnancies past the age of viability. In other words, usually 20 weeks is considered the age of viability. Past that 20 weeks. Primipara is a first-time delivery. Multipara is having delivered more than once. So we record the GTPAL. Again, gravida, G, is the total number of pregnancies. T, term, the number of pregnancies that ended at term. P is preterm, the number of pregnancies that ended after 20 weeks, but before the end of 37 weeks. Abortions, which are the number of pregnancies that ended before 20 weeks. And L, living, the number of children that delivered who are now alive when the history was taken. We need to know her medical surgical history. It helps us identify risk factors for infectious diseases, HIV, AIDS, other STIs, her immunization status, etc. We need to know family history because it provides the need for genetic testing or counseling. And social history. What type of environment does she live in? What resources does she have? Is she employed and where? What is her support system? Does she have a risk for IPV, intimate partner violence? Is there substance abuse or abuse? What are her hobbies, such as gardening? Because, there's animals that roam around, feral cats that will pee and poop in the garden, and mom can contract diseases. And are there any animals in the home? Then we do the physical exam, which is the head to toe exam. The doctor will do a vaginal speculum exam and do a bimanual examination of the uterus. Lab work will be completed, and this will include a CBC, determine her blood type and antibody screen, hepatitis B, HIV, syphilis, gonorrhea, chlamydia, a rubella titer, urine culture, pap test, vaginal and anal cultures, screening for hypothyroidism, and a glucose tolerance test. Education will be provided for steps to make sure that it is a healthy pregnancy. So to determine the due date, the EDD is the estimated date of delivery. EDC is the estimated date of confinement, which is an older term meaning the same thing. And we do that at the first prenatal visit. Ways to determine the EDD, we use the Naegeli rule, which is adding 7 days to the date of the first day of the last menstrual period and then subtracting 3 months. We can determine it by uterus size, obstetrical sonogram. Those landmarks in the pregnancy include quickening, which is when the woman first feels movement, usually between 16 and 20 weeks, and the fetal heartbeat, which is evident at 10 to 12 weeks. So Naegeli's rule. True or false? When doing a GTPAL, you know that the T stands for how many pregnancies a woman has had that ended at term or beyond 38 weeks gestation. And that is true. We need to complete a risk assessment, which incorporates and evaluates data from the history, physical exam, and the lab tests. Risk factors can also include an unwanted pregnancy, late or no prenatal care, substance abuse, maternal diseases such as diabetes or HIV, a history of a difficult pregnancy or pregnancy complications will put subsequent pregnancies at risk. Social factors, which include inadequate living conditions or domestic violence, the use of tobacco, alcohol, or deficiency of folic acid in the diet, and age. Young adolescents and women over the age of 35 increases risks. So subsequent prenatal visits are going to be shorter in length. Usually they're once a month for weeks 1 through 32, with every other week between weeks 32 to 36, and then weekly after 36 until birth. These visits are going to include specific assessments such as weight, blood pressure, urine protein and glucose, the fetal heart rate, the fundal height, which is from the symphysis pubis to the top of the fundus. Weeks 18 to 32 centimeters should match the pregnancy week. If the fundal height is different, it should be investigated. There might be something going on. Recommended screenings would include the maternal serum alpha-fetoprotein between weeks 15 and 20, gestational diabetes between weeks 24 and 28. The RHO negative woman should be screened for antibodies, screening for group B streptococci, and cell-free DNA blood tests for moms with a high risk for Down syndrome. Now, not all of these screenings have to be completed, and moms should know that because some entities will say that we need to do this, and they don't tell mom that it's optional. So this is a picture that just shows the different heights of the fundus at different weeks. We also need to assess fetal well-being, and some of the ways these can be done are listed here. We'll discuss it. Just prior to starting this discussion, we need to discuss methods to stimulate fetal movement because some of these tests are dependent on fetal movement. We can give mom a cold drink, a drink with sugar in it, such as orange juice. We can do vibroacoustic stimulation, such as placing an electric razor on mom's belly and turning it on, or headphones with music, clapping next to the abdomen, or even physically moving that uterus. So some of these fetal well-being exams include fetal movement or kick counts. This is done by mom at the same time each day. She just kind of lays down and relaxes. Shouldn't take longer than 2 hours to get 10 counts. So she counts the number of movements within a 2-hour period. If she does not get 10 movements, then she should be calling her healthcare provider. An ultrasound. This is the gold standard for gestational age and potential complications. It uses that high-frequency sound wave to help visualize fetal and maternal structures. It can be done to determine or confirm gestational age, observation of the fetus, and it will diagnose most fetal and placental abnormalities. It can be done transabdominal, which is non-invasive, but we may not be able to visualize everything, and it no longer requires a full maternal bladder. We can also do this transvaginally, which actually provides a clearer picture. And Doppler flow studies. This is basically measuring blood flow through the fetal blood vessels. The maternal serum alpha-fetoprotein test is recommended for every pregnant woman between 15 and 18 weeks, especially in multiple pregnancies, to determine neural tube defects. Elevated levels are associated with various defects, in particular fetal spinal defects, but even though it may come back as positive, mom can still deliver a healthy newborn. Elevated levels can lead to intentional pregnancy termination. An amniocentesis is aspiration of amniotic fluid through the abdominal wall to obtain fetal cells for chromosomal analysis. This would be done between 15 and 20 weeks gestation. Chorionic villus sampling. Similar to the amniocentesis, but it can be performed earlier, 10 to 12 weeks. Placental tissue is aspirated through a catheter that's introduced through the cervix, or it can be done transabdominally. Percutaneous umbilical blood sampling is similar to an amniocentesis. However, the fetal blood is withdrawn from the umbilical cord for testing instead of amniotic fluid. The non-stress test is a non-invasive test. Mom thinks something is wrong, or mom is high risk, or mom thinks she might be in labor. We have her come in and we do a non-stress test. We measure the fetal heart rate acceleration patterns for 20 minutes. We should see accelerations that are 15 beats above the baseline that last for at least 15 seconds. That is what is considered to be a good response. So if we have a reactive non-stress test, we find that reassuring, and we can assume that if the fetus were to deliver within the next week, the baby would tolerate labor well. Not guaranteed, but it's what the pattern generally follows. A contraction stress test is a non-stress test, but we supplement that with contractions, either from nipple stimulation or the administration of oxytocin. We want to see 3 contractions that last at least 40 seconds within 10 minutes. We determine fetal response to the contractions. We do not want to see late decelerations. A negative contraction stress test is reassuring. Positive indicates we have fetal hypoxia. And a biophysical profile. This combines the non-stress test and several ultrasound measurements of breathing, movements, tone, amniotic fluid volume to help predict fluid or fetal well-being. If we have a score of 8 to 10, great. A score of 6, possible asphyxia. Score of 4, probable asphyxia. Score of 0 to 2, poor fetal well-being. It requires immediate fetal delivery. So, if the results of a maternal serum alpha-fetoprotein are lower than expected, it may indicate that the baby will be born with what? And it would be Down syndrome. Every pregnancy is going to be different, but most women experience similar discomforts, but not necessarily all of them. Table 7.2 in your text provides causes and suggestions to help relieve these discomforts. So some of them we might see would be bleeding gums, nasal stuffiness or nosebleeds, nausea, vomiting, feeling faint, frequent urination, increased vaginal discharge, shortness of breath, breast tenderness, heartburn, back aches, round ligament pain in the abdominal area, leg cramps, constipation and hemorrhoids, trouble sleeping, fatigue, varicose veins, ankle edema, and flatulence. So it's really important for mom to maintain that balanced nutritional intake. She should gain 25 to 35 pounds depending on what her prenatal weight was. With her dental hygiene, if she has a lot of vomiting with morning sickness, she needs to make sure that she rinses her mouth with water or chews gum after vomiting because of that acid. Do not brush the teeth for a while because that can actually decrease the amount of enamel on the teeth. Exercise. Box 7 to 6 in your text provides exercise recommendations. Otherwise, normal exercise patterns are okay. Walking is always a great exercise. Hygiene is important. Breast care, even during pregnancy, needs to have that well-fitted, good supporting bra. Washing her breasts with water only. If she's not in danger of preterm labor, she can begin to toughen her nipples. Clothing needs to be loose and comfortable, especially around the waist and legs, so it does not cut off circulation. Sexual activity is acceptable unless there is a history of preterm labor, vaginal bleeding, ruptured membranes, or other medical contraindications. Most jobs are going to be fine up to delivery, but there is an increased risk of low birth weight, preterm delivery, and hypertension with those jobs that are physically demanding. So it's important to encourage these women to take frequent breaks to change position, elevate their feet, walk, and limit exposure to teratogens. There's no issues with traveling during the first trimester, but After that, during the second and third trimesters, it's probably important for mom to take her prenatal records with her. Excuse me, for the simple fact that, what if she has problems? These physicians are going to need to know what her history is. With long trips, stop and walk at least every 2 hours and to empty the bladder. And do not decrease fluid intake. It will increase the risk of blood clots. Medication and herbal remedies. Understand that most medications are going to cross the placental barrier and can adversely affect the fetus. So never take medications without provider approval. Acetaminophen will be given instead of ibuprofen. No ibuprofen during pregnancy. Most women will be taking the prenatal vitamins and folic acid or calcium supplements, and a lot of women will take antacids if they experience the heartburn. FDA pregnancy categories. Understand that there are categories for most drugs, and it basically shows how much of a risk they are to a developing or growing fetus. We have A, B, C, D, and X. Major components of prenatal self-care. Avoid alcohol, smoking. Eat healthy, well-balanced diets of about 300 calories more per day than before the pregnancy. Take an extra 400 micrograms of folic acid a day. Avoid dieting during pregnancy. Continue to exercise during pregnancy. Avoid handling raw meat and cat litter. Handle uncooked meats or the cold cuts carefully. Avoid douching. And avoid taking any medication over the counter or herbals without consulting the healthcare provider. Substance use is the use of a substance while abuse is having a problem with the substance. Some things that we don't even think about would be caffeine. Taken in moderation, it's usually okay. But the March of Dimes recommends 200 milligrams per day. Tobacco, backing up to caffeine, we know what caffeine does to us. It also does that to the fetus, so keep that in mind. Tobacco is contraindicated during pregnancy. It leads to low birth weight, preterm delivery, early pregnancy loss, stillbirth, SIDS, birth defects, and asthma. Alcohol should also be avoided during pregnancy because it is a known teratogen. We may also see the fetal alcohol spectrum, excuse me, where we have microcephaly, facial deformities, growth restrictions, and cognitive disorders. Marijuana. There's contradicting reports. However, it can lead to increased risk of preterm delivery, newborns that have high-pitched cries, tremors, and a low birth weight. Cocaine increases the risk of maternal cardiovascular dysfunction, leading to maternal hypertension, placental damage, early pregnancy loss, low birth weight, preterm delivery, placental abruption, and infant withdrawal. Preparation for pregnancy, for parenthood, for delivery improves confidence and demonstrates positive coping methods. Packing for the hospital or birth center, usually done in the third trimester. It includes mom's clothes, newborn clothing and items to be used during labor. Now, mom's clothes, she shouldn't start packing pre-pregnancy clothes. She's going to still need those pregnancy or maternity clothing. Excuse me. Labor and birth preparation. Are there any questions or expectations that mom has? Does she want to be medication free during labor? Does she want to be able to walk, etc.? Does she have a birth plan? Has she chosen the support person, which is usually her partner, but it can also be a family member or a doula? Uh, Having a family member or doula in the room with the partner is also often seen because that frees the partner up for just providing emotional support. Childbirth education classes determine the method that's best suited to the woman's personal philosophies and the availability of the classes. There's different classes available that focus on different things. Pregnancy exercise classes can help improve endurance and strength for labor and decrease pregnancy discomforts. Baby care classes are especially good for first-time parents or those that have no to minimal experience with babies, but they can be beneficial for all expectant parents. Breastfeeding classes, these are helpful in assisting moms in knowing what's normal, how to, establishing milk supply, etc. And siblings class helps prepare siblings for what to expect and how to handle those babies. So true or false? The nurse should refer a nulla gravida client to a dietitian to assist the client with dealing with dieting to help slow down a client's weight increase of 2 pounds per week. This is false. And now on to the post-test.